welcome to Live with Hillsdale Hospital. Today is Wednesday, September 4th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lodge, Chief Communications Officer, and I'm joined as always by
J.J. Hodshire, President, Chief Executive Officer.
And JJ, would you like to introduce our guest?
I
believe you're meeting for the first time
We
today.
are. This is our very first time meeting together this morning. And this is Bradley Scott Hodshire, and he is going to talk to us about some exciting things that are happening up on one of our very specialty units that I'm proud of. Because we had a chance, Rachel, you and I, to design some of that work. And we're going to talk a little bit about how that came into fruition and a lot of the work that's being done up on that floor, a lot of great work to return our patients back to healthy living and regaining their life back in many cases. So I'm very excited to welcome you, Brad. Is this your first time?
Nope. No, this is his like third or fourth time.
Really?
I think it might be fourth.
Okay.
Really? With us? With me?
Well, there was one where you weren't here.
Oh, that's why I don't remember it.
So
Then
yeah,
there was-
we did the
that's
but
true.
I think for live though, I think this might be your third or fourth one.
Okay, I was thinking it was his third or his fourth time here. But it's great to have you back.
Hey.
And we're going to talk a lot
First
today.
live for September, if we can believe it's already September.
Oh,
It is, isn't it?
I know.
It's crazy.
is
62
weird.
days left until the election.
Oh,
Just throwing that out
I
there.
haven't been
Don't
counting
know
that
the date,
down.
but
Just throwing that out there. Right.
Yeah, I'm not really paying attention.
No one is.
To the days.
Right.
I'm just paying attention to like how many minutes until like my next meal, until I get to try to go to bed again, and like.
So
you know,
that's
but
going to be 35
small children.
minutes.
You never know.
Yes, small kids, hard.
Yeah. So anyway, that's
Yes.
why I look tired today. So let's talk a little bit about wound care.
Yeah.
So Brad, to start, tell us just a little bit of your background for our viewers who have not seen episode 1, 2, or 3 with you.
Like,
in the
who is
past.
Bradley?
Right.
Who is Bradley?
Who are you? Yeah.
So I started out actually as a nurse assistant on McGuire McRitchie. Worked there for 9 years as I was going to school full time, become an RN. Did that, worked on med surg for 3 years, and then came into this leadership role for wound care.
So CNA, Certified Nursing Aide.
Yep.
And then where'd you go to college? Jackson. Became a registered
Got a
nurse.
scholarship of-
And you got a scholarship, so that's great. And then became a nurse working the third floor, or which floor did you work?
med surg.
Med-surg,
Yep.
okay. And then talk to us a little bit about this opportunity that came available, because it's really a unique partnership that we have. You want to talk a little bit about what you do now? What is that on that floor?
Yeah. Tell us
Yeah.
about the Center for Advanced Wound Care and
Yeah.
Hyperbaric Medicine.
Yep. So we've got a front desk coordinator. She'll check in the patients. Have them sign for treatment. They'll come in. The nurse. We have 2 nurses. We have a hyperbaric tech, and then we've got nurse practitioner. That's there Monday through Friday. Dr. March, Dr. Bidney, and Sabrina's the nurse practitioner. We'll see patients inpatient and those on the outpatient floor.
All right, so, the word hyperbaric medicine, what is it? Talk to our audience a little bit about when they hear that. Is everybody going to need this? Is it a select population? Give us some understanding
Yes.
about.
There's certain indications that insurance will cover because they did the research and it works. So
Okay.
that's why they'll pay for it.
Okay.
So diabetic foot ulcer with, it's got to have either deep abscess or infection of the bone with it. There's some arterial insufficiency diagnosis.
Bradley, I don't mean to interrupt you, but I need to. Is it just for diabetic patients?
No,
So
no.
it could be anybody who has
Arterial.
a wound.
A
Right,
non-healing
it could be.
wound
A
that
non-healing
meets
wound.
certain criteria.
Exactly. Yes.
Okay.
Yes.
All right, so then they have these wounds. They
Yep,
present.
Correct. And then we had to do 30 days of treatment. So we make sure, hey, this isn't working, this isn't working. So it's kind of
What does that
less
treatment
difference.
include?
So dressings, diet, make sure the diabetics, their A1Cs are good.
Yeah.
And then the correct dressings. And then we get to our advanced modalities, which would be like our skin substitutes or hyperbarics.
So let's before we talk about hyperbarics, let's talk about skin substitutes as well as. Do you see a large majority of your population that do heal without the need for those two?
Yes. Yep.
So, all right,
What
insurance.
percentage would you say?
I want to say it's like 8%. I believe is what our ratio was from wound care to going to HBR.
Oh, okay, so,
So
it's a
only
small number.
8% end
Right.
up doing the hyperbarics. The other 92% are able to just benefit
Yeah.
from.
Yeah.
Thank you. I
Exactly.
rarely
Yes.
do math, you
Yeah.
guys. But if it's out of 100,
That's why I gave her a.
Even
Yeah,
some of the
that's easy,
hyperbarics
but-
don't come from wound care. It could be a radiation
Oh,
internal
true. Okay.
wound,
Yeah,
soft tissue radiated across the skull.
Well, let's talk about that in just a minute.
Radiation.
So, patient presents. You have 30 days of insurance. You have to cert them. You have to get them qualified, right? They just can't show up and say, "I want to do it today."
Correct.
So you get the insurance that covers it. Do you generally see insurance covers it?
Yeah.
All right.
Most of the time.
If we meet the criteria
All right.
and all that.
They're
Because you
probably-
basically have to prove to the insurance company, we've tried everything else.
Mhm.
This is the next best option that
Okay.
is evidence-based to heal the wound, right? Because otherwise they won't cover it because they're like, we don't, insurance companies, they don't want to
Yeah.
pay for people to
Right.
try things.
Yeah.
And
right?
Medicare, Medicaid, it automatically pretty much comes back approved.
Mm-hmm.
But if they ever come back to audit it, of course, you have to make sure that
Documentation.
these
That they've
are
got- I
correct.
see.
These are
Yeah,
why
yeah.
we're doing it.
So patient presents, you have 30 days or so, they are not healing. Step 2 is graft immediately, or is that,
Not
an
even
option.
if they're shown, it has to be like a certain percentage over a certain
Right.
amount of time.
so you do the graft. Now, I'm interested in the graft because the graft, you have a company that provides these?
Yeah, there's a few.
And what is it? What are they? Is it human cells?
There
What are we
are.
talking about?
There are some from human. There's some from fish in Iceland. There's some from pig. I mean, there's all different types.
Fish from Iceland.
Yeah.
Wow.
Yeah.
Kirsten, does she go there and harvest those then?
She probably
Oh, she does. Okay,
yes.
so fish from Iceland. And what other animals?
There's pig.
Pig.
Wow.
Does the patient get to select what they get?
No,
as
the
a treatment?
provider typically picks.
Okay.
I mean,
What's
let
the
them
right
know what it
product
is.
for, okay.
All right.
Exactly.
Got it.
So then they select. All right. So then they do the skin graft.
Mhm.
How long does that take?
So when we put it on, so they'll sometimes the reps will even come and just be there just in case the provider has any questions. So if we put the skin sub on, it's called Adaptic. It just goes over it so that way
Mhm.
the skin sub's protected. And then we put a dressing over that to
Okay.
keep it in place.
Okay.
That stays there for a week.
Okay.
If there's a lot of drainage, we can replace the outer bandage, but we want to keep that skin substitute in there for the week.
Got it.
For one whole week.
Yep.
And then you change it out.
They come back, we do another debridement because you have to do that debridement first, get the blood flow. You want the skin
Oh,
sub
I
to,
see. Right.
to
So
live.
debridement
It kind
is
of
you take
triggers
the
it
skin
to
That's sharp.
connect.
and you basically are scraping it.
Yep.
And you create blood cells. Obviously, blood comes to the top,
Mm-hmm.
and then that debriding creates what
Uh,
healing
Yes.
opportunity.
Yeah, bringing
right.
nutrients and oxygen to the
All right.
surface there. Yeah,
And then how long does that take for the skin graft process?
it depends. Everybody's
Okay,
different.
so everybody's different.
Yep.
On average, are there any averages or no?
You get approved for typically it's like 10 applications. That's what we do, and then we'll if it's healing really
Okay.
good, then we'll submit for more.
So the insurance says you get 10. Here you go. So that's 10 weeks.
So we say 10
Correct.
applications, that's a skin
Skin
graft layer, let that go for a week, then add another one, and then let it go for like,
Yep,
it's,
they'll clean
you're
it out at
basically
the end.
layering skin grafts on top
Well-
of each other over a period of time?
Yeah, essentially.
Okay.
I mean, by that time it's
Interesting.
usually dissolved, or
Right.
disintegrated, or it's
Hmm.
the wound is healing. So
I
it's
see.
getting
Yeah.
All right.
Okay,
So then
that's
the third
fascinating.
area is going to be what we're engaged in with two units right now, but that's hyperbaric.
Mhm.
Explain what that means, though. What does hyperbaric mean? What are they doing?
Yeah.
What's happening?
So it's pretty much governed by the law of physics. We know that increased pressure and increased oxygen helps wounds heal, our body heal. So
And not
it's-
just wounds, though, right?
No.
For hyperbaric.
correct.
Okay.
Correct. Yep.
For
Yes.
us, yes, but
For-
out there in the
Or
world,
really,
don't
yeah,
like
other
football
countries, yeah, you
players
can do
and
whatever,
stuff
yeah.
do
But are we only doing
hyperbarics
wound?
for stuff?
Or we do it for other, like I heard cancer treatments or things of that nature to
Post
regenerate
cancer,
stuff.
so breast cancer, if they're not healing well, we
Okay.
can do
So
that.
it's still
They've
associated
had
to a
a-
healing, to a
healing.
wound healing
Absolutely,
issue. Yeah.
All right.
Yeah.
All right. But go ahead.
Have you guys ever seen Curse of Oak Island?
No. Is it a movie?
Right? It's so good.
Oh,
The
it's a
first time,
show.
it's a show. They're
Oh.
digging for buried treasure up
Oh.
in like Nova Scotia or
Oh.
something. It's great. The two brothers who run it are from Michigan. They're from like,
Really?
Traverse City,
Yeah.
I think.
We're from the Curse
Anyway.
of Camden.
So
Exactly.
they were diving in this big deep well out there digging for treasure,
All right.
and they had a hyperbaric chamber there like
Yes.
on site for
Oh,
the
in case
diver
they-
to get in afterward.
Yeah.
Because of getting like the bends or whatever. So
Yeah.
explain, because when you guys have someone go into the hyperbaric chambers, you say they're diving, right?
Yeah.
So explain that whole thing, because it is actually associated to like legitimate diving.
Yeah. So
And before he answers that, is there any way that Kirsten can show what a picture of one of those looks like?
One of ours?
Yeah.
Yeah.
All right.
Yeah,
There she
she'll,
goes. Awesome. Go ahead.
perfect.
Straight
So diving, like you said, the bends. If you're out deep sea diving and you come up too fast, you can get the nitrogen bubbles right in your blood, and then that can kill you. So what they do is they'll put you in a chamber, and it brings you up gradually instead of
Mhm.
quickly, to keep that from happening.
Mhm.
So just like your, that's the decompression sickness. Then you've got carbon monoxide poisoning, right?
Oh.
Patient comes in,
Mm-hmm.
all of that is on the red blood cell, preventing oxygen from getting on it. So now when you're in hyperbaric, it's putting that oxygen in the plasma as well, and it's kicking that off. So it's it's a lifesaver, obviously.
Yeah.
But as far as diving, it's just like going deep sea diving.
Because of the pressure.
Yep. It's
Except
like
it happens to
atmosphere.
be full of oxygen instead of water.
Right. Exactly.
You know?
So that's a good
Slightly
point.
different.
We had a patient that thought that.
Oh,
They
They
thought
thought
really?
you put a
were
mask on, and then the
No.
chamber fills up with water.
Oh my goodness.
So once
That is my
they,
nightmare.
They seen, they
You
were
have a mask
very
on.
hesitant.
No,
No?
still.
Okay.
Mm-mm.
All right.
Terrified. Being in an empty tube is a little scary to me. I don't like clear elevators.
I was in
so-
it.
Right.
I know.
It's not bad.
I was not.
It's not bad.
It's not.
No, it isn't really.
You
It's
can't even
glass.
really tell.
I mean,
Acrylic,
it looks
acrylic.
much more comfortable than I would have
Acrylic,
thought.
Yeah.
But yeah,
So,
we
so
digress.
yeah, we do. So basically, the patient is diving. In other
Yep.
words, they're stationary.
From the pressure.
But the
yes.
pressure itself is being increased. Is that over time, or do you do
Yes.
that immediately?
So it's overtime. It's like 1 ATA, right? Is
One.
like atmospheric pressure.
Oh,
Okay.
okay.
So that's
the
like
unit
33
of pressure.
feet, right?
Right.
Okay.
That takes at a rate of 1. Okay. It takes 14.7 minutes, or we'll just say 15 minutes
To
to
get
get to
down
that.
to like 33 feet of
Mm.
depth
Mm.
in
Right.
terms
So-
of the equivalent pressure. Okay.
The patient's first dive, we always do that at 1 to make sure they're tolerating, because the ears, just like on an airplane, you want them to
Mhm.
pop or clear.
Okay.
If not, you get ear pain, which easy fix. Go to ENT, get tubes, you're back in.
Oh,
It's
okay.
pretty simple.
All right.
We've done that a few times. As far as coming up, we do the same thing at a rate of 1. So the provider will check the ears before and after to make sure they
Mhm.
look good.
Oh, good.
After that, it's usually 1.5 will go.
So do you take? So after you're done with that session, then you have to take them back up to normal pressure, the same increments.
Yep.
So how long does the dive last then?
They could be in there from 2 to 2.5 hours.
2.5
Well, it's 90 minutes at depth.
So 90 minutes.
Okay.
So an hour
So
and
by
a
the
half at
time
depth.
they get, is that one ATA the depth that everyone goes to, or are some people deeper than others based on like their
Right.
condition?
So I guess we're at 1 ATA. So when we go up to 2, we go to 2
I
and a half.
see.
So it takes about that much time to get there.
Okay.
But does everyone go to like 33 feet or
We can go
whatever?
to 2.0 to 2.5 ATA.
Okay.
But everybody goes to it.
Yeah.
All right. So then they go through this dive.
Then they do it again every day. For
So that's
like,
what's next. So how long do they do this?
Monday through Friday for
Monday.
6 to 8 weeks. Or more if it's working.
6 to 8 weeks every day.
Mhm.
So like if they're working, this is a
It's
major
quite a
Yeah,
commitment.
huge commitment.
Yeah.
major
You'd
commitment.
probably
We've
be
had-
on like intermittent FMLA, I'm guessing.
That's exactly what. Yeah, we've had patients do that.
Okay. So I'm intrigued. So they do this heavily regulated by insurance companies because it's very expensive. And so then you're going through the process. When someone's approved, so our listeners know this,
Yeah.
for diving because their wound isn't healing, is it guaranteed that they get those 8 or 10 weeks, or do you have to certify this every week?
No, we get the approval. We send in. We build a packet saying, okay, this patient's had this for this long. They've been on this antibiotic. This is why we're doing this. We have
Okay.
to build that case. Then our team sends it to the insurance, and then they'll kick it back and say
Right.
yes or no.
Okay.
Typically, 90%, 99% yes.
Okay.
Some insurances have, expensive out-of-pocket
Yeah.
expenses.
Mm-hmm.
I know priority for us is like $290 a visit,
Ooh.
Right.
which we have, linked up with patients' accounts,
Right.
and set up a payment plan
To
for
help
the- for the
patients with
patient.
Because it's hard.
That's
It
great.
is.
So
yeah.
Bradley, there is always this, with diabetic patients, there's a lot of focus on self-care and self-exams because I'm told that even a little needle prick on a diabetic patient can lead to some very bad outcomes.
Yep.
All right, so patients engage. Why are our diabetic patients impacted more than I am with a needle prick, a cut, or a contusion?
Yeah.
Why
And
is that?
Neuropathy is one thing, right? You don't even feel it.
Okay.
So then it's there, it's festering.
I see.
Because your
see.
nerve endings aren't responding like
Right.
normal.
So you're
and
not
so you
able
just
to
don't even
address
know
it.
that you have a wound.
Okay.
And then you're more likely to get something in it and get it infected.
Yep.
Blah, blah, blah.
Okay.
Yep, and
That
then
makes sense.
sugar, or bacteria like sugar. So if a patient's sugar is always high, bacteria's gonna
Going to
Got
attract to
it.
it.
yes.
It's because of their sugar levels in
Okay.
their body.
Yep.
So this is
That
more
makes
than
sense.
just diving. This is
Oh,
about
it is.
an individual's lifestyle. You know, do you tell them to, do certain things when they're diving at home, like don't eat as much sugars, don't do this, or what do you say to
Yeah,
them?
yeah. We it used to be if you had an A1C over 9, we couldn't do hyperbarics unless it's showing that it's
Oh.
improving. So if they had an A1C of 12 and it's down to 10.5, it's coming down, we could. But
Is that because of insurance or because of medical?
probably a little of both.
Okay.
Yeah.
Yeah.
All right.
Okay.
Medically,
So
they're not
between
going to recover.
whatever medication they might be on and
Mhm.
whatever diet or work they're doing with a dietitian, they have to get their A1C down
Yeah,
to a
'cause
certain level.
We'll check the sugar before and after. It can drop like
Yeah.
100 points of sugar while they're in there. So
Yeah.
we
Oh.
make sure they eat before
Yeah.
coming in
Yeah.
and
Okay.
diving. We check the sugar before and after.
All right. And then when you say diving, before Rachel asks the next question, sorry to ask all the questions here, but they're in this chamber, 2.5, 3 hours, whatever the timeline is, and they can watch TV.
Yep.
They can read.
Yep.
Not even with above them.
Well, technically,
like
yeah.
TV read, that type of thing.
Oh, yeah.
Like,
Yeah.
Okay, no electronic devices whatsoever.
Nothing
Obviously,
in the chamber. Yeah.
nothing in the chamber.
Just the patient and they're in a gown.
We
There you
ask
go.
them to take a shower, no hairspray, no deodorant, anything like
I'm
that.
in trouble.
Mm.
This thing survived tornadoes,
Yeah.
storms, all kinds. All right, so no
You can't have shellac in your hair for that?
So-
No?
shellac. I
Like-
have not heard that phrase since never. So nothing. They shower here or at
No,
home.
at home.
Shower at home. They get in. Now, we're talking about if there is a reaction, you can stop the dive, right?
Correct.
If you have an issue or a concern going on with the patient. Have you had a situation where a patient just gets in and is like, I can't do it?
Anxiety, absolutely. Yeah, it does take. I mean, once you get to a point and we come back up, then it does take some time.
You
It'll
can't
take-
just immediately open the door.
No,
Yeah.
if you,
And you
if
tell
you
them
come back
this.
up, yes,
Like-
if you come back up at like too fast of a speed, you can get like a pneumothorax. So your
Oh, she's
lung
a what?
Your lung
pneumothorax.
could
So your lung
basically
knock pretty much.
collapse.
Okay.
Yeah, exactly. Then you need a chest tube, and it's
Yeah.
so that's.
So
And
you
for
tell them if
situations-
you're in it, you're in it for at least this session
For at least the 15 minutes to get back up
to
from
get
depth.
back up.
if we're all the way
Once you're
at-
down. Yeah.
Yeah.
Yep.
But they can see all around. Did we show a
It is.
picture of that? So the
Yeah.
picture is now up, and this
It's
kind
a
of
bigger
gives.
tube than it looks like
Oh,
too.
it's
Like when you're
huge.
standing outside of it looking at it, you're like, oh my goodness. But then when the doors open and you stand at the end and you're looking in, you're like, oh, that's really spacious.
Yeah, it is very spacious.
It's not as cramped as
Yeah.
it seems like it would be.
So patient gets in. Patient has anxiety. Can the physician order any type of anxiety medicine?
Yes. Yep.
Okay.
Oh.
She can order outpatient,
Okay.
or to their pharmacy.
Like
they pick it up.
Ativan or whatever.
Exactly.
And they would
Do you-
take it before they come.
before they
That
come, or
and-
can you
and
administer
Mr.
it
Driving.
there?
She'll prescribe it,
Okay.
and then they can bring it and take it before going in.
Right.
Got
Because if they're driving and such,
Yeah.
so they can get,
They would take
there is solutions though. So
Absolutely.
if our viewers are saying, oh my God, I could never do X, my anxiety,
Mhm.
there's options.
Yes. Yeah.
They can
Yeah.
receive some medications that can
Right.
resolve some of that anxiety, put them at ease to heal.
Mm-hmm.
I think that's an important aspect to really touch on.
Yeah, we had a very anxious patient. They got in. They said it's not bad at all.
Yeah.
They
Oh,
were,
good.
They were very surprised.
Nice.
Good. So hyperbaric medicine is obviously not something that everyone has everywhere.
Right.
It's more unique in terms of a specialty type of care and treatment that can be offered. So for a rural community like Hillsdale to have not one but two
Mhm.
hyperbaric chambers in our program, how unique is that?
It's
And how
great.
far away are we seeing patients come to us in Hillsdale? It's not just Hillsdale County residents
no.
that we're seeing.
Oh, we had somebody come from Coldwater. We've had quite a few that have interest coming that were further away. But as far as what was the first question? The first part.
How unique is it for a rural hospital
Okay,
to
yeah.
have two hyperbaric chambers?
We actually had a patient say that they couldn't afford the gas to go to Jackson every day.
Oh, yeah.
So this is their only option
Mhm.
is being local. They
Mhm.
couldn't afford it.
Or
so-
not getting the care.
Exactly.
And what happens, I mean, a lot of times this is preventing the next
Amputations.
step, which would be
Yeah.
amputation.
Amputations.
So this is hyperbaric medicine, what stands in between
Yeah.
a patient and that limb.
I think that's
sometimes.
important to really touch on because prior to hyperbaric medicine, there was no intermediary. It was, if
That's
you
right.
didn't heal, it was amputation. Now you have this option, which, you've seen success stories, Brad,
Oh yeah.
and are we saving limbs in life? can you share with our listeners maybe a success story, no names obviously, but a success story or something in your mind that where you're like, wow, this is where it's at?
Yep. As always, my favorite, I shared it last time, osteoradionecrosis, so it's death of the bone caused by radiation. It's in the jaw. To the point where couldn't put a spoon in his mouth. And we did a patient testimonial on it. It's on the website.
Yes. Yeah, so you can use a name because this is
Okay.
already up there on our website.
All right.
But he actually self-referred. He's like, me and my wife are looking at options. We've seen that this works. I'd like to give it a shot. So within the third treatment, he said the pain was starting to go down. And then in just a couple weeks, he's able to open his mouth. By the time he did those 20 treatments, and we coordinated with the oral surgeon. Went to U of M, he had the surgery done. And then he came back and did 10 more dives. Since then, I reached out to him like a year after he finished to see how he's doing. He said, of course, he's been there for checkups and all that. But really, everything's been great. He's gained like 20 pounds.
Yeah.
So he's eating again.
Right.
He wasn't able to eat.
Yeah.
That's amazing.
It's wonderful.
It's an amazing story.
Imagine somebody having to lose their jaw or live with the pain and infections all the time.
Well, and one of the things I think you told me before about using hyperbaric medicine for people who have previously had radiation, it's not necessarily because they have a radiation burn immediately after having had treatment, right? It could be years later that because they've had radiation, they no longer heal with the same efficiency or the same rate that they would have.
Yeah, it could be 20 years later.
Wow.
Yep.
Okay.
We actually had that. Patient had a wound on his leg, wasn't healing, and we were able to do hyperbarics, and this was years and years later. So those cells just never healed.
Never healed. Wow.
Right. Right.
Wow.
So the wound was not 20 years old, obviously.
Right.
But because he'd had radiation however many years ago,
Compromised.
once he had that wound, it was not healing like it would have had he never had radiation therapy.
Correct. Yep.
That's really, that's something I think a lot of people don't think about. Because that comes up, you may have been in remission for, to your point, 20 years. And then something else comes up that's associated with that, and you're like, well, now what do I do with this? But Hyperbarics has been very effective for that.
Oh, yeah.
So.
Well, before, Bradley, we take any questions and have a little fun segment here, I want to talk a little bit about, we talk about in healthcare a full continuum of care, right? Full continuum is making sure that the patients receive from A to Z care, and to provide that here at Hillsdale Hospital, and that's what we strive for. But working in the wound care center, it's not just wound care. You're working with podiatry, you're working with vascular, you're working with general surgery. Can you talk to us about how those dietitians, tell us how all of that, infectious disease, infection control, how does all of that come to play in each of those roles?
Yeah.
Could you talk to us about that relationship?
Yep. So number one, blood flow. Patient doesn't have blood flow, they're not going to heal. That's what's, like I said, bringing the nutrients and the oxygen.
That's why you do the debridements.
Yep. Cause it to bleed. However, if they have a blockage and it's not bleeding very much, those arterial wounds we're not going to cut on.
Sure.
You're not going to get the result you want. So we send to vascular. We'll continue to see them. We can do a mechanical debridement, just like kind of clean it up, put the dressing on, keep it clean. They have the vascular procedure, get the blood flow.
So a vascular procedure could be anything from getting a stent in the vein or whatever.
Yep.
Okay.
Typically pretty quick.
All right.
It doesn't take too long. And then, we get the notes from them saying, yep, we're good with this. On the other hand, venous, we want to do compression with a venous ulcer.
Yeah.
Pushing that fluid back up. If they have arterial issues, you don't want to do compression. So that's how we work with them.
So you need to know what is the baseline of this patient, right?
Yep.
So a full workup is done on every patient?
Yep.
And is this primary care responsible for that, or is that what your nurse practitioner is doing?
That's what we do.
So we do the full workup here, determine what the history and physical is on that person, et cetera?
Yep.
All right, so then vascular, you have a relationship with them.
Yep.
All right, podiatry.
Podiatry, typical, they're the specialists, right, for the foot. So, like, Charcot foot, right? It's caused by neuropathy. You start getting like a breakdown in the changes of your foot. It's almost like a flat foot. But that's something that, that's their specialty. They can go into surgery. They can do different options. Size them for boots, shoes, whatever they need.
Okay. And then other disciplines that you're involved with that you can think of?
Yeah, infectious disease. If we get a culture back, it's got tons of different stuff. We've hit it with antibiotics. It's not really working. send them there for their specialty. Dietitian, if an A1C is out of control,
All right.
usually over seven, something like that, we'll send to
Right.
see a dietitian to talk about the diet.
So
Yeah,
really that
just
full
all
continuum
around.
of care
Yeah.
to make sure the patient as a whole
Yep.
is being cared for. And then are you seeing any of, like there's Manjaro, there's all these drugs. Are you seeing any impact of that on your patient population?
I've heard Ozempic
Yeah.
mentioned, and I've heard Manjaro mentioned. Yeah.
All right.
Yep.
And they're engaged with the dietitian on those discussions with their primary care. All right. So really full continuum of care. If you have a wound, something is not healing, we have a wound center. And I'm sure Kirsten will put up there the number that can be called to make an appointment. Self-referral, Bradley,
Yep,
or
you can.
physician referral?
Either or.
Either or. So if I'm just
Okay.
having this and want to bypass my primary care, I can just call you directly,
Yep.
and you will schedule it.
Yep.
Do you do the authorization as well in advance, or do
We
I
do.
just show up first?
No. Call.
So call, schedule,
We're
get
very
the
busy.
insurance.
Yeah,
Okay.
Yeah.
And you accept all insurances,
Yep, yep.
and do you do private pay as well if needed?
Yep.
Okay.
Absolutely.
Very good.
All right. So, do we have any questions from our audience?
Wow.
Okay.
We answered them all, Bradley. That's
So-
great.
Right.
I believe we're playing a game. Kirsten has decided what game it is because we were all debating what game we were playing.
Okay.
Or are
I
we
think-
doing
I think
multiple
two
games?
games.
What are we doing? We're doing two? Okay, great.
there's only time
what
for
a, What a
one,
wonderful
but,
compromise.
yeah.
Okay, great. So what's our first game, Kirsten?
Blast from the past.
Blast from the past. So
past.
this is a Hillsdale
This is-
Hospital historical fact that we have to guess something about. Okay.
All right. And incoming. Great.
And is
Great
Brad
fight,
doing
guys.
this one with us?
Oh, well, all right.
Here's your whiteboard and your marker.
I
Yeah.
think I know all these.
I do not.
Oh my word.
All right, so the
Read
blast from the past. In 1992, were you even born in 92?
I was 5.
You're 5. In 1992, Bradley Hodshire turned 5. You were 6. You were 2? Were you really?
Yeah.
Oh my gosh. Nuh-uh.
Yeah.
In 1992, when Rachel
At
was
Christmas,
2,
I was 2 years old.
and I was like 40, we had a Christmas dinner dance to raise funds for 2 new birthing rooms. What was the event called? Can we phone a friend, Doris?
Yeah, she's
Tell us
right
what,
like 2 doors down.
Yeah, what was the, okay, so
Doris, help us.
dinner dance to raise funds
For 2 new
for
birthing
2
rooms.
new birthing
Are there
rooms.
any, like,
What
are
was
those
the
context clues
event
that we could maybe guess what the name is if we don't actually know it, or if we don't know it, we're not going to get it? Like the fact that it's for birthing rooms and the fact that it was around Christmas, does that help us
The fact
figure it
that
out?
it's around Christmas would help.
Okay.
So
A dance? A dinner dance.
Dinner. And the name, so this is the name of the event.
it's guessable.
In what century?
So for this game, do we have to have an answer?
So you were 5.
Yeah.
It can
Okay, call your mom.
be a
and say, "Do you
legitimate answer or a
remember?"
pretend answer, so. A dinner dance? In 1992.
Alright.
Is there a song about the name of this?
And dancing. It's what? There's not a song. There
I
is a
said-
song.
You know the answer.
Oh, she doesn't know. That means there probably is.
Like
It probably
Frosty
is maybe
or,
related to a
something
song.
like
Or like I have a guess. Probably wrong. Christmas dinner dance.
Two birthdays.
Okay. Do we need to get a little timer for ourselves?
All right,
It's
so
gonna take
let's
forever.
do.
I don't like it.
I don't know. I can't even think of anything. All right, I would say. Yeah, I don't know. It's dinner dance.
I have a guess, but
All right,
okay. Are we-
I'm done. I don't even. I can't even.
just
think
write
anything
something
creative.
down.
Okay.
Write down anything. Write down what you would have named the
Oh,
dance
there's a
in
razor down there.
1992 if it were up to you. What did you say?
I said, oh, there's no razor.
Oh,
there.
yeah.
I had to use my hand.
Problem is you have to let it dry for a minute or it just gets kind of smudgy.
Let's say.
Even then it kinda does.
I don't know, man. I don't know. I there. Giving. I don't know. Jeez.
I guessed rocking around the Christmas tree dance.
I said the Christmas ball.
That
There
would
you
have been.
go.
Hers would have been great.
You're all wrong.
Yeah.
Yeah.
It was called Holiday Fantasy.
Holiday
I almost wrote
fantasy.
I-
That is
I-
not guessable at all.
How
I
is
erased
that
holiday,
guessable?
But not fantasy.
I was gonna say like rocking
Yours was at
around the
least
Christmas
creative.
baby, but she
Look
said
at
it didn't have
Bradley.
anything to do
Original
with
Christmas ball.
it.
Mine.
Christmas-
Yeah, giving.
Giving. I know how stupid that was.
Thanksgiving.
Yeah. Oh, all right. One last thing, is there or no? All right. What's the last?
So,
Oh, so as I talked about earlier,
Oh,
Yes.
another spelling bee.
Sharko foot. Can you spell Sharko?
Oh my word. Sharko foot?
Sharko foot.
What is Sharko foot again?
Give us the origin.
It's like,
please.
What is the definition, please?
I asked not for that.
Oh,
Um,
what is it? What is
Oh.
the? What is it?
Yeah, what's
so
Sharko?
it's
Drop
like
foot?
neuropathy. It can create. It's like the ligaments or bones. They kind of break down. I guess is the way to say it. It's
Sharko.
yeah.
Sharko. We're supposed to be spelling Sharko, right?
Yes.
Not foot.
Well,
It's not all one
I
word.
guess
Is it two words or one
you
word?
just spell Sharko.
Okay. But it's two words.
Sharko.
It's not like one
Sharko.
compound word. Okay,
That's
great.
one word.
Sharko.
That is one word.
Is it named after a person? Or is it a...
No idea. Probably.
How many letters?
I can't tell you. Apparently.
Okay.
I don't know about this.
All right.
Okay.
You ready? I drew a
You-
picture
you
I
too.
tried to spell it like it was French.
You should have kept your other one. You were very close.
Was I really?
It's
Oh,
CHARC.
I erased it.
COT.
Ah.
That's what I was thinking in my head, but I was like, there's no way that's it.
Did you like the drawing? This is like the foot does.
Do I
that,
get partial
right?
credit because I got 4 letters? Oh, well, he got 4 letters,
So
so never mind.
I don't know.
It's still a walk on it.
That
Oh,
was
you
a
can
good
still walk
one.
on
Yeah,
it.
you get
All right.
boots and
Oh,
all.
the
Yeah.
boot. Okay. Then the
Oh,
leg
that
needs
was
to
the
go
foot.
like that. That was the foot.
It's going
Well, I
up.
didn't see it before. I assumed you drew a shark.
That'd be,
because when you spelled it. I
good
didn't
homework.
actually
You
look
can
at it
Google.
until
All
just
right.
Google
Wow, that
Sharko
was
foot.
fun.
Sharko.
Take it away, Rachel.
Sharko, like escargot,
Escargot.
OT.
That's
So it's probably
escargot
got to
when
be
you're
French
in-
then,
yeah.
right? So
All right. Next.
it's on the right
next
track.
week.
I think I was
we
going
will-
more of a Cajun direction with the
I
French.
think so.
Okay. So
All right.
as we close, thank you for enjoying our game and hopefully
Yeah.
laughing at us thinking we can figure these things out sometimes. But we do want to, yeah, I know. Did anybody out there know that? Like,
Of
come
course
on.
not.
Come on. Nobody. I'm pretty
kidding
sure
me? Where
Kirsten
did she
just
even
opened
find
up
it?
the hospital history book and she went like
There's
this.
a hospital history book?
There is. We
And
have
picked something.
3 series, like right, like
There's
volume 1, 2, 3.
bigger volumes and there's like a shorter abbreviated version.
Yeah.
Yeah.
That's cool.
Yeah. When the
Yeah,
hospital
it's pretty cool.
opened in 19.
It's got like every newspaper article that was ever written about the
Yeah.
hospital. I mean, it's pretty cool.
Yeah.
It's neat. So to close, we want to thank you, as always, our community, for your continued support. If you want to connect with us more, visit hillsdalehospital.com/live, which is where you can do all the things we normally talk about. So you can nominate a hospital team member for our patient care awards, support our capital fundraising campaign,
Please.
learn about volunteering, consider joining an award-winning workplace in the healthcare industry. We do have positions available on our website under careers. Or on hillsdalehospital.com/live, because Kirsten has all the links for us there as well. You can also catch us on WCSR on Fridays and Buzz Online on Saturdays for our radio updates. And don't forget to check out our national podcast, Rural Health Rising, at ruralhealthrising.com, or subscribe wherever you get your podcasts. And we will see you here again next week. And until then, stay safe, stay healthy, stay Hillsdale strong, and choose Hillsdale first.